Hello, my name is Eugene Yale, and I'm from St. Mary's, Ohio. And I was diagnosed with 2 types of cancer, one in my stomach and one in my colon. And I'm very happy to say today, they say I'm cancer-free. And my doctor here in Troy was Dr. Kakari, and I am very happy to say that he really took good care of me from start to the present day. And if I had a doctor to come back to, I would recommend him 100%. I'm very well pleased with this doctor. And I do want to say that there's several nurses here, and one that took care of me was Miss Tiffin. And she done just a wonderful job for me to this present day. And also all the other nurses that are here are top rate. And the receptionist out front, you couldn't ask for better.
My name is Janice Yale. I'm the wife of Eugene Yale, who was diagnosed with cancer in 2 sites at the end of December of 2023 by Dr. Bryant, who did a GED as well as a colonoscopy. When he found the 2 masses at 2 different places, he was kind of at a loss as to what to do. So he called Dr. Kulkarni down here at Dayton Physicians and asked him which way he should go. How do we get help for this patient? Dr. Kulkarni said to send him down to me. And when we arrived here, we were greeted by a lot of friendly people, receptionists, nurses, and everything. And the first thing we noticed sitting in the waiting room was the big placard that says that Dayton Physicians and the James Cancer Hospital were affiliated with one another, to where we knew that with their union going back and forth that we would get some of the best treatment we could possibly get. After we met with Dr. Kulkarni and he had an opportunity to go ahead and view all the information that was given him, he said he could probably start on treatment himself, but we would be going to several different places. So he recommended sending us to the James, which we were looking forward to doing anyhow. He contacted Dr. Rahman from the James Cancer Hospital, and between the 2 of them, they set up the treatment for my husband Eugene, and he didn't waste any time. He had everything in place as far as the treatment, what was to be done, when it was to be done, and everything went very smoothly. He had chemotherapy for the colon cancer, and for the stomach, they decided to use immunotherapy to take care of that one, since they were both a little bit differently, and that was what they decided would be the best treatment for both of them. And from there, we went ahead and did the first cycle of cancer treatments, and we're going to do the stomach surgery first, and with Dr. Dilhoff down at the James Cancer Hospital. But they wanted to go ahead with my husband's age and have him do a stress test. And when they did that, they found out that he had a blockage in the artery called the Widowmaker. So he was sent from a Sydney hospital directly over to the Ross, which is right next to the James, and they went through what he had come up with, and at first they were not going to do anything. And then Dr. Hussein, who is the surgeon for the colon cancer, happened to come in and say he was going to talk to the heart team and see if there wasn't a different kind of stent they could put in so he could at least do the colon cancer and get rid of that. Well, the heart team said that they would not consider anything until he went through a PET scan, and if the cancer has spread to any other areas, everything was off the table. When they did the PET scan, they came back very much surprised, as well as we were, when the only thing that lit up was the colon cancer. The stomach cancer was not lit up at all. And when they checked that out, it was decided that they would not take out and do the stomach cancer because it had already been taken care of by the immunotherapy. So then the heart doctors decided to put in a stent, which cleared up the blockage in his widowmaker. And then a couple of days later, Dr. Hussein said that they would go ahead and do a couple more rounds of chemotherapy, since he had been off it for a little while, make sure his heart and everything was stable. And then after Dr. Kulkarni did the next round of chemotherapy for his colon cancer, we set up an appointment down at the James again, and Dr. Hussein went ahead and performed the colon cancer with a very good opportunity of saying that everything was taken out. He had all the biopsies came back negative. There was no indication. There was some polyps in the area that were also removed and biopsied, and they all came back negative from Eugene. So when we went back for our checkup after surgery, he was safe to say that my husband was cancer-free. As far as Gene's treatment for his cancers was concerned, between the Dayton physicians, Dr. Kulkarni, and the James Hospital with Dr. Aman, they've got a very good connection with their treatments, with their scheduling. If you ever had a question or something and you got a hold of Dr. Kulkarni, he says, let me get a hold of Dr. Rahman and I'll have an answer for you as quickly as I can. And it turned out to be just that way. You had an answer within a short period of time, and you knew where you were going, what was going to happen. So between the two of them, they've got a very good affiliation between Dayton Physicians and the James Cancer Hospital. And we couldn't be more pleased with the treatment we received, the doctors that took care of him. The nurses were very friendly and outgoing as well. So even though he was diagnosed with cancer, you might say at times we had a good time in the hospital. If there's anyone that is diagnosed with cancer of any sort and need help in their treatment, I would definitely, and my husband as well, would go ahead and highly recommend Dayton Physicians and the James Cancer Hospital for the best treatment you could possibly get. They're outstanding in their medical treatment, in their work, in all their doctors and everything. And it would be beside ourselves if we didn't go ahead and recommend them to any family members, any friends, anyone who might see this video, to go ahead and contact Dayton Physicians or in the James Cancer Hospital for the treatment they might need for their cancers.